The South London Listens project, this is rooted in a new approach to listening and consultation. Could you tell us briefly about how this project started and maybe the role of the listening campaign and how you managed to train over 350 local people to hold deep and meaningful conversations in their communities?
Yeah, Tom, I can, and I could talk for hours about this. But just a very quick intro. So I'm Director of Communications for South East London Integrated Care Board and the system, which you can see behind me. And I'm also Director of Comms for South London Maudsley Mental Health Trust as well. And I worked for local government for about 10 years in London Borough of Lambeth and for London Borough of Hounslow. So very good understanding of what happens in local authorities. Essentially, this program came about because we recognised early on with COVID that there's going to be a challenge with those people who were experiencing lockdown, a cap on incomes, people couldn't get out. Social isolation is a big issue around in London, and there's a whole range of factors that we thought actually were going to impact people. And these are people who are not using our services, but are people who are struggling, and we knew that was going to happen. And so we held a series of, I mean, if you think back to the height of the pandemic back in around about March, June time, 2020, we held team sessions with around about 1,000 people at a time. So we held these massive conferences to get an understanding and a flavour of what was really on people's minds. And what was really, what really kind of shone a light on this was that you brought a group of experts together. And we're like, well, actually, you know what they're going to be caring about? They probably want more detail in their appointments. They want more X, Y, and Z. They might want lots of other kind of innovations. And then when we went out to ask our community, well, what really matters to you? They came back with something completely different. And it was about being humble, having a humble inquiry to understand actually why that is important. So recognizing that we couldn't do this ourselves, right? The NHS or local authorities, we don't always have that legitimacy and credibility in our communities. So it's about making sure that you work with partners. And we work with a charity called Citizens UK, which have got really strong links in with community organisations across London to help us start to facilitate how do we go out and build relationships or partnerships with community organisations. How do we empower people to start to talk about some very simple things like what is having an impact on your mental health? How can you get involved to support your community? Do you want to take a leadership role in talking to people about this really important thing? And I genuinely was really impressed by the fact that this wasn't a statutory institution led piece of work. It was an absolute collaboration. And I never forget, I mean, I'm sure we all cast our minds back to those days when we were doing our Teams or Zoom calls. There was a young single mother of 3 kids who was, struggling, and it was really challenging, but she was really engaged on her mobile phone whilst chaos was ensuing everywhere and worried about whether she's going to have a job or not, but taking part in this program about understanding like how could she help people in her communities, in her housing estate. And for me, I thought actually, if we can have more people like that are taking ownership and helping to build community resilience, is really important. So really important for us to have an established link. Citizens UK, we're fantastic. I'm sure other colleagues across the country will have different voluntary community sector organisations. Really important about getting the buy-in. So actually, I remember emailing all the leaders of the council across South London to get involved and to really badger them in a nice and kind way that this is really important. And they came forward, and that was really good. And then it's about having that connections, the one-to-ones, talking to people about this, building that momentum. We had a number of what we call house meetings where you just bring people together to talk about these subjects. And then I think the other thing was letting go of some control. So I having worked my entire career in public sector in comms and engagement, to then go, actually, I'm just going to do something different here. I'm going to trust in a different methodology and just let it run its course in that way. And it was fantastic. I better be quiet there, Tom.
No, that's cool. So it's great to hear that willingness to let go and embrace community engagement. So it sounds like you had lots of conversations, you were hearing lots of things from communities, but once you actually got those ideas together, I gather you needed to make sure that decision makers actually took them seriously and that they led to action. So could you tell us about some of the methods you used to achieve that?
Yeah, totally. So it was really important that what you don't do is, well, sorry, what we hear all the time is, why are you asking me this question? I mean, I've already answered it several times before, and actually you've done nothing about it, is often what we hear. So it's really important that we don't fall into that pitfall again. And so you have to take action. And what you did, so from that 350 group of leaders that were out actually talking, engaging to folk, we reached out to 6,000 people that actually contributed to this conversation. And it was a massive, massive contribution. Um, there were 4 priorities that came up of what were really important. There were work and wages, parental and children and young people's mental health, access to services, and social isolation and loneliness. So they're really, really broad things that could factor. And actually what we did was we flipped the conversation. So when I said earlier that back in March and June and the height of the pandemic, we held these series of like online summits. They were institution led. They were like, okay, tell us your problems, what are the issues? And actually part of letting go of control was going, look, actually this isn't ours, this is a community. So the community organized themselves, and I was very nervous about this. They organized themselves to hold a community accountability assembly, and actually they invited us, the institutions, to their assembly, and that was like a power shift dynamic. And having very little understanding what the agenda is going to be, we had all our leaders of the council there, all the chief executives of the mental health trust. We had fantastic, incredible buy-in from our councillors, and I just cannot say enough of how important they were to this conversation. They were fantastic across the political spectrum. So the accountability assemblies were essentially saying, you've asked us, we've told you, now you're here in our home, and we want you to pledge to doing these things around the 4 priority areas. And they asked for, becoming living wage councils. They asked for NHS trusts. They asked for community embedded worker schemes to help migrant and refugee communities. And they asked, and the leaders pledged to those and said, yes, we will do those. And then the thing was, it didn't end there. It was actually, you will now need to publish an action plan within 4 months, and then we will hold you to account at the next assembly. So we held an assembly last year, and then we held one, the year before, then we held one on the 10th of October. So there is a relationship happening of accountability and an understanding that that's really, really important to this piece of work, because it builds that legitimacy. People get to see what's going on. And I should say, it sounds like it's a lot of hard work, and actually once you get that momentum going and you get people understanding what's happening here, and you build that resilience with communities, and communities start to see a difference happening, it becomes a lot easier. And I never forget the first time around we were doing this, trying to get people to like put some money in and fund it and support some of the work was just really, really like interesting to get people to the same page. But once people got it and actually understood that we're trying to support our communities, and whether you work in the local authority or you work in the NHS, the residents are the same, right? They're the same people. And actually, if we work together collaboratively, we can have a much, much bigger impact, and everybody gets to celebrate from the success. So that's how we make sure that decision makers are held to account and take this seriously.
Thanks, Ranji. And finally, could you give us a sense of the sorts of outcomes from this project? So you mentioned an action plan, and in that action plan, there were particular interventions or ideas of services or things that communities wanted to see. And I imagine some of them would have been new things that you hadn't set up before. So could you just give us a flavor of the sort of impact of this work in terms of those interventions? And then maybe if you've got sort of plans for expanding this, or getting more people involved as you sort of become a more integrated care system, like where you see the future of this sort of work.
Yeah, great. So I think the interesting bit was when right at the very beginning, when we were trying to say to people that this is the thing we want to do, we're going to try and create a movement, and we were trying to get funding, and people are like, I just don't get it, don't understand this. What are you actually going to do? And we're like, well, no, I can't tell you this because we haven't gone out and listened to people, and we haven't co-produced a solution. So I can't really say we're going to do these 5 things. And actually, when we tried to do that, we brought 50 experts together, and they came up with an action plan, which our community said, look, it's not what we want. We want something different. And so some of the things they came up was a living wage plan. They came up with, I mentioned, a community embedded worker scheme, which is for people, for migrant refugee communities who don't have access to services. And actually, we've got a number of pilots in place now with people being hosted by food banks or local schools. And we've spoken about parental peer support groups. So this is about supporting people and young families. Yesterday, I was in a session with 20 clinicians talking about how we go about creating a CAMHS virtual waiting rooms. This is, recognizing that we've got long waits, but how do we support people and create that journey for people whilst they're waiting? That directly came from our population and the people that we serve, our residents. And I've already mentioned London Living Wage, but I'm quite proud of that. Actually, about two NHS trusts and 2 local authorities are now paying London Living Wage since this programme, which is, a significant amount of change. About 3,000 people have been uplifted. And the second part of your question, Tom, was how do we continue to sustain this? Is that right?
Yeah.
So ultimately, we produced a 2-year action plan, and we said, look, this is a finite piece of work around 2 years. But we recognise that cost of living's come up, and it's a major issue. And actually, a lot of people are struggling with this, whether they're from an institution, a voluntary community sector, or a resident. And actually, how do we kind of pull this together to have a longer program to it? So we have secured funding from our ICS systems across South East and South West London. We've also working with NHS Charity Together and local charities to be able to fund some of this work. But the other thing is, it's about actually building this in, baking it into our day jobs. And so I don't want anybody to think from this, oh, like, this sounds great, it's amazing, he must have had millions of pounds and all of that sort of stuff to make this happen. That's not true. The reality is actually what we've said to people is that you already get paid to do community outreach work. And actually, if we change the model as based on this, actually, how do we make sure that that 100 community outreach workers are starting to do things slightly differently or engaging with the community differently? So the opportunity that we've got to kind of like look at existing models and to update them and to look at the job planning around it is really, really important. And the rest of it is we've established a academic evaluation committee, which essentially has got a representation from Centre for Mental Health and a number of other very complex titles that I won't go through right now. And they're evaluating each of the pilots. So ultimately, what we want to try and do is create a blueprint for how you prevent a mental health crisis as a result of COVID, but also fundamentally, how do we support people through the cost of living crisis, and that actually, how do we empower communities? And I should just very quickly mention, one of those ways is something called Be Well hubs. So going back to the point I was saying, that we don't have legitimacy from an NHS organisation entity to like go out and tell all the people of the world, you need to be doing things our way. Actually, we've got no right to necessarily do that. What we can do is support those 350 leaders that came forward and said, how do you want to do this in your communities? So some communities, some leaders in mosques or churches or faith groups or schools or barbers or whatever have said, actually, in my area, I can do these few things. I can run a workshop, I can run some training days, I can do some other things around how we educate and support our local community. And essentially, it's about how do we upskill those people so that we're creating Be Well hubs in each of the boroughs that we serve. And they're not funded, they are actually all voluntary, they're people giving their time. And the aim is to be able to create a micro community in every street. People can connect and join up.
Thank you so much, Ranjit. So a huge volume of work there, and it really took sort of bravery and courage from local authorities and NHS to trust communities to lead on this process and to be willing to be held accountable and to go with the proposals that have come up with those communities. But we could see the brilliant work that's come out of it and the huge potential to generate change and positive mental health in South London. So thank you so much for sharing your story and inspiring us with that.